Hello, everyone. My name is David Siambe. I'm the head of a policy and analysis division at APO. Today, I invited Felicia Kawilarang, Vice President of the Halodoc from Indonesia. Felicia, how are you doing today?
Good. Hi, everyone. I'm Felicia Kawilarang, the VP of Marketing at Halodoc.
Okay, thank you. Let's just show one short video about Halodoc, and then let's continue the discussion right away. Okay, let's get started. Let me just start with this remark that good health of human capital contributes to GDP per capita, mainly through higher participation of the population in the labor force and higher labor productivity levels. If anyone is interested in this, you can look it up in the Google, Health Expenditures, Longevity and Growth, 2009, published by Oxford University. So anyway, Felicia, thank you very much for your time today. And the reason why I invited Halodoc today is because it's not only because Halodoc has raised a lot of investment from many different stakeholders, it's more about the value proposition. And what Halodoc is doing in Indonesia is amazing and also very good practice for other entrepreneurs in other member countries. So maybe you can give us some explanation about the Halodoc and what is your value proposition, what problem you try to address.
Sure. So Halodoc is actually a healthcare tech company. We are focused as a one-stop solution, and our mission is to simplify healthcare in Indonesia. Currently, we have multiple services in our app platform. We have telemedicine. You can chat to a doctor or video call through our app. You can also, we have pharmacy delivery, a health store basically, and you can get your medicine, vitamins, or any other healthcare products delivered to you within 1 hour, straight to your house or your office, wherever you are. We also have lab home services, where a lab assistant will come to your house, draw blood, and bring it back to the lab, and you can get all your results back in the app. And then our last but newest service is actually appointments, which is hospital appointments through the app that now is being used for appointments for rapid testing during this pandemic.
Thank you very much for the explanation. Felicia, I have a question about how Halodoc started. There must be some motivation or some reason why your founder and you yourself decide to do this together. Maybe can you share what was the motivation?
So our founder, Jonathan Sudarta, is our founder and CEO. He first looked into the problem of healthcare in Indonesia because he used to work in the medical industry as a salesperson. And in hospitals, he would see that there were a lot of waiting lines in front of the doctor's office. And people would wait almost 4 hours in the hospital while they're sick to get into a doctor consultation and to get their medicine from the hospital and then go home. So it took a total of almost 4 hours. And he thought that this was a problem that he could easily solve, especially with how technology is today. So that's actually the problem he wanted to solve. And when we got together, when I joined Halodoc, we started thinking, what are some more ways we can simplify healthcare, right? One was teleconsultation, which is talking to a doctor through our app, but also not only teleconsultation, but also through pharmacy delivery. So that was actually the main problem we wanted to solve, which is all the different disruptions in Indonesia when it comes to going to a doctor, because mainly there's a lot of traffic here.
We call it macet, right? Macet, traffic jam.
Yes, there's a lot of macet.
Yeah, I mean, basically, so what you're doing is to connect the patients to the doctors through the app. And also when people want to buy let's say the medicine, they just cannot buy the medicine without a prescription. So they want to consult with the doctor first. So maybe we can explain a little bit more how it works.
Sure. So you can download the app, and then what you do is you can actually pick a variety of doctors. We have 20,000 doctors in our platform. Not all of them are online at once, but we usually have a doctor that's on 24/7. You can choose minimum. There's about 20 doctors online at any given time. You can basically talk to any of the doctors, look at their ratings, because we allow our users to rate the doctors. You can pick the one with the highest ratings, the one with the longest experience. Those are all information are available inside the app. Once you pick a doctor, you can either chat or video call or voice call, whatever you're comfortable with. And then you can basically start the conversation from there. Once the doctor diagnoses you, he is able to give you an e-prescription, which you can click on, and then straight away will take you to our pharmacy delivery service, which then, if you decide to buy the medicine that is recommended, will be delivered to you to your doorstep basically in 1 hour. Our average time of delivery is actually about 35 minutes, which is very fast in Indonesia.
Yeah, I think so. For example, if let's say they use a Halodoc, then if I have to see the doctor, I'm afraid that I might have to pay a lot of money because consulting with the doctor is not cheap. How do you charge people?
So right now, actually, we have different charging system for general GPs and specialists. So GPs right now on the platform cost about 15,000, while specialists cost about 25 to 35,000, depending on the specialist you're talking to. So that's very, very cheap. Almost, it's more than 50% cheaper than going to consultation at the hospital.
So 25,000 rupiah is almost like a $1.5, I think.
Correct.
Right? Wow. So I mean, how can you make your business sustainable? Is it okay?
So basically what we do is we take a cut of all the consultations from the doctor. We don't charge the patient. We take the cut from the doctor side. We also take cuts from pharmacy delivery service, where we take a cut of the sales done through our pharmacies into the platform. Yes.
Okay, so it sounds like you're doing a great job. So what is the value proposition for Halodoc? Do you have some kind of tagline, or do you have some kind of value proposition that you want to deliver this and that?
Our value proposition is actually simplifying healthcare. That's across Indonesia for now.
Okay, very good. So how many islands in Indonesia? I think it's 17,000, something like that, right? Correct. It's the largest archipelago, right? More than that.
Yes.
So Halodoc is being intensively used in Jakarta more, or nationwide, pretty much?
So Halodoc is available nationwide for our teleconsultation service. For our pharmacy delivery, because we work with pharmacies, we don't actually keep our own stock. So what we do is we have a network of pharmacies. Right now we have about 1,700 pharmacy networks across Indonesia in 60 cities, 60. So we're available everywhere, but right now, to be honest, we've been focusing more on Jabodetabek, which is the greater Jakarta area, and on the larger cities. So like Surabaya, Bandung, but definitely people in the smaller cities have been using us, but we haven't really focused too much in the smaller cities and regions, to be very honest.
Okay, let's talk a little bit about yourself before we go further. Because I know that in Indonesia, you had like 4 unicorns. And then if we include like OFO, and also it's maybe 5 unicorns. And then, but still, ecosystem for startup companies in Indonesia, even though it's going well, I know that you also studied in the United States. I heard that you studied finance. And then you could easily just stay with a consulting firm like Deloitte or some other Accenture like yourself. But then there must be some reason why you decide to join the startup.
I think for me, the reason why I decided to jump from Accenture consulting through to healthcare industry and especially a startup was because I was looking for something that would give me meaning and mission in my life. One of that was I wanted to do something good for the country, for Indonesia. And one of the problems that I saw in Indonesia is that our healthcare system is very complicated. And with technology today, there must be ways where we can improve it drastically, right? So when I found John and he had the same idea, John, our CEO, I was quite surprised and very excited to join and build Halodoc together with him.
Okay, so now we are talking about COVID-19, and people have to practice the social distancing, and people also need some medical assistance and medical services. But since people cannot get out easily, there must be some challenges for that. But at the same time, since in Indonesia you have Halodoc, so maybe now, in a sense, that it's a good timing for Halodoc to serve your people more better. So can you tell us a little bit more about the situation with the COVID-19 Halodoc?
To be very honest, like COVID-19 and the pandemic we have seen an increase in surge and interest in healthcare in Indonesia across. There has been a high interest, of course, in e-health, like in companies like Halodoc. In total, we've seen a 10x increase in transactions since COVID started rising in Indonesia, which is around March. So it's been about 3 months now, and we've seen about 10x increase in all of our services. One thing that we did have to move quickly on was because we are a healthcare company, we wanted to make sure we can help Indonesia during this pandemic, right? So we iterated a lot of our products. For example, appointments. Appointments was for hospital appointments to see a doctor in the hospital. But because right now during the pandemic, it's actually not good we don't encourage people to go to the hospital unless you need to. One, because, social distancing. Two, is because the doctors should be busy with, helping with the pandemic, and anything that can be taken care of at home should be taken care of at home through teleconsultation services like Halodoc. So in that sense, what we did was we started moving our appointment product to help the government with rapid testing. So what we can do now is you can make an appointment on our app to do a rapid testing in any of the hospitals in Indonesia that we're partnered with.
Okay, so but still, when you talked about how you start your startup before, it's a good idea. It was fantastic because you saw the problem, you identified the problem, pain point. But it's not like we can just go out and just build the application and then just make it happen. So maybe you can see the question that what is the biggest challenge when you start this business?
In the beginning, actually, what we did exactly was we built an app right away. Okay. But a lot of people, a lot of the challenges around building Halodoc was more in terms of trust, because no one's really seen an e-health application in Indonesia before. One thing that we had to prove was the doctors in our platform are trustworthy. We work with trustworthy pharmacies. So that was something we had to build, right? The trust in our brand. But two, also educating the market. I don't know if everyone here has been to Indonesia or know any Indonesians, but actually a lot of Indonesians don't care too much about their health. What I mean by that is there's not a lot of preventative healthcare in Indonesia. Not a lot of people take their vitamins. Not a lot of people go to exercise, walk every day. It's just not a very health conscious type of society. So even when people are falling sick, what happens is usually people will ask their friends or family first before going to a doctor. And we see that from our survey and research that most people who do feel sick will only end up seeing a doctor if they wait about 12 days and they still have not recovered yet. So that's actually quite a long time period before consulting to a doctor. And that actually is a behavioral problem that Halodoc is educating the market for since the beginning. So one thing that I think would be the biggest challenge for Halodoc, even to date till today, is actually the consumer behavior and the health conscious behavior in Indonesia.
So how did you manage to change or educate the market? I mean, it's easier said than done. I can just easily say that, oh, yeah, we had to educate the market. We had to help people to change their mindset. And there must be some ways that you make it happen. Like,
Right.
did you open like campaigns or some special promotions, or how did you
So
manage to make it happen?
we did a lot of campaigns around being health conscious, what it means to take care of your health. But also one thing is before, when we first started, we were only an application. And we focused more on our product, which is teleconsultation and pharmacy delivery when we first started. But because we saw that there was actually a lack of education in health, we opened halodoc.com, which focused more on health content. So now we have kind of a library for health in Indonesian, so that Indonesians can have more access and easily access, kind of like WebMD, maybe, that you can read up on different types of sicknesses that you might have, different types of ways you can take care of your body, what is healthy for you to eat if you have diabetes. Those are all available now on halodoc.com. And that's actually a library that we built till today to make sure that more people will be educated around health in general.
How about the doctors and pharmacists? Because we're talking about customers, we're talking about the market. So when the users are not familiar with using this kind of device or application, and that's one thing. But those service providers like doctors, physicians, pharmacists, if they don't
Sure.
know how to use it very well, so how did you help them to be educated also about this?
For our doctors and pharmacies, we actually have a training program where we have a head of doctor and head of pharmacist that works for Halodoc that trains out the specialists on how to, for example, treat customers inside our platform versus off platform. We saw that a lot of doctors had a hard time giving patient care through digital. Because 90% of our services is done through chat, actually. Consultation, a lot of Indonesians prefer chat over video call. They feel more comfortable talking on chat because a lot of the reasons behind that is one, they say they're not comfortable showing their home because if they're at home to their doctors, and two, they don't want to get ready, put on makeup, maybe if they're female, and talk to a doctor at home while they're sick. So actually 90% of our service for consultation is through chat. And that's actually something we have to train, because we saw that a lot of our doctors would have short messages, and a lot of our patients in the beginning, 4 or 5 years ago, would complain that they thought the doctor was not friendly enough. And so that was something that we had to build over time.
Okay, thank you very much for the good explanation. Let's just go to the next question. I remember reading the headline, this Indonesian startup, Halodoc, has become the Gates Foundation's first healthcare tech investment. How did that happen?
Oh, actually, it's quite interesting. John, our founder, actually met Bill Gates through a media outing, maybe like 7 years ago, before he started Halodoc. And this was just by chance. And then, so when Halodoc started, actually the Bill and Melinda Gates Foundation remembers John, and they reached out to us. They're actually the one that reached out to us and asked us if we can help with some of their health campaigns. One of the health campaigns that they're focusing on in Indonesia is with childbirth through midwives. So that's something that they were interested in and asked Halodoc how we can help. Luckily enough, Halodoc actually has a network of midwives across Indonesia that we already work with. So that's actually how they became one of our investors last year. because one of their health campaigns actually matched up with ours, and it was an easy deal for them, I guess. They don't really see it as an investment in a tech company. They see it as an investment in a tech company that can actually help with their health campaigns. And
Do you remember that the intro video that I showed to the viewers? There was a scene that where the Gojek driver delivered the medicine to the customer.
yeah,
So we also work with the Gojek.
Gojek is one of our investors since early seed.
Okay, so in Gojek, they have like a super app. Inside the super app, there is a GoMed. So Halodoc is also in the super app, or you work together but separately in the app?
Oh, okay. So GoMed is actually Halodoc. Yeah. So
GoMed is Halodoc.
yeah. So we're integrated in the Gojek system. If you click on GoMed, it will take you to the Halodoc app.
Okay, got it. It makes sense.
So we are integrated, and they're our pharmacy delivery network. So we use Gojek drivers to deliver all our medicines and vitamins to the house.
Okay, maybe you must have some like episode that how the Halodoc has been helpful to patients at the last minute, or when they are really having like a crisis or some any difficulties. Do you have any story to share, like an episode or something that you remember?
Sure. So usually, I mean, all of our consultations are confidential. I just want to put it out there.
Yeah.
So actually, I'm not able to see any of the consultations because, of course, it's a private information for our users. But we do see a lot of feedback and positive reviews through our app rating, or sometimes people comment on our social media and tell us a story on how they feel helped by Halodoc, right? So I think one thing that really stood out to me, I guess, would be in general, right now during the COVID-19, we've seen a huge rise in mental illness. And we've seen a lot of comments on our Instagram right now regarding how people feeling help because we've launched our mental health service recently. And we have now psychologists and psychiatrists in our platform. And a lot of people have commented and said that they feel less lonely because they have someone to talk to when they have to be isolated. They feel like they have someone that can help them think about how to manage the anxieties around the pandemic. So to be very honest, I think working for Halodoc during this pandemic has brought me to think about how amazing actually this platform is. And how useful it is for a lot of people. And I'm very grateful that a lot of people have been using us and feeling helped by it. Yes.
Okay, thank you. But this telemedicine, actually, in other countries, I mean, some countries actually it's not that easy to implement because of the regulations, because of the opposition from the Association of Medical Doctors. And there are many reasons also that people cannot easily just implement this kind of best practice in their own countries. Can you share your experience with the regulations and our government side, how you deal with this issue?
Yeah, to be very honest, we've been very lucky because the Indonesian government and the Kementerian Kesehatan, our Department of Health, has always worked with us from the very beginning and told us that they will help us every step of the way to innovate and improve healthcare in Indonesia. So one thing is we've been very lucky because our government has this mindset of wanting to improve healthcare system and healthcare experience in Indonesia through the help of private companies like Halodoc. So actually, in terms of policy, John sits very closely with the Department of Health to kind of decide what will work for Indonesia, what won't work, what is good and what is not. So actually, in terms of launching new products, we're always working very closely with the Department of Health to make sure that we meet certain rules and regulations, but also to push forward those boundaries. And they're actually open to it and will allow us some leeway before real regulations are made.
So in a way that actually the people, I mean, the government also really cares about the people. And
Correct.
that's why you all the support from government side, right? So
Yeah.
let me just ask one question from live chat. There's Astri from Indonesia. So as a startup, you have many products as providing services to satisfy customers. So what do you do to maintain your customer? I think she's talking about customer management and
Sure.
customer relationship.
I think one, in terms of maintaining customer, you should always focus on your product, right? You should always make sure that what you're providing is relevant to your customer, but also if you're asking more around customer management and how to get people coming back on the platform, we always make sure that we always continue to engage with our customers through our CRM, which is our customer relationship management platform. So for example, we make sure to push notification and remind people to take their medicine. We also have a service to remind people if we think that they might be out of stock already, and to remind them on a continuous basis, like, hey, you might want to buy your medicine now or vitamin now. And Halodoc, because the last time you bought it was 1 month ago. So those are kind of like easy ways for us to get customers back onto our platform.
Okay, thank you very much. Thank you very much. Let's just go back to the other questions. That so how many employees do you have at the moment?
Halodoc now has about 600 employees.
Wow, 600? So
Yes.
you are employing so many people, and then you're actually helping society also a lot with that. So how do you manage all of those people during the COVID-19? They cannot work in the office.
Yeah, so our policy for Halodoc is actually till today, we're still working from home. Unless we have people who cannot work from home. For example, sometimes finance, they cannot work from home, so they come to the office on a very short basis every week. But we actually haven't had a hard time with working from home. I think we've hired a lot of people who are very responsible, and what we always measure is output, making sure that they're meeting outputs. We don't really monitor in terms of that sense what they're doing on an hourly basis, as long as the output comes on time and is correct. So we haven't had any issues with working from home. We've run everything through Zoom. We still do everything on Zoom meetings, so we haven't had any problems.
Okay. Now, actually, as you know, those are sectors who are hit hard, actually are laying off many employees, and they are suffering a lot. In Halodoc, how is it going with this pandemic and then all those layoffs things?
We haven't had, fortunately, to lay off anyone, but we have actually hired more people, to be honest, during this pandemic.
Okay.
Because our business has been growing. So we've been lucky in that sense.
Okay, thank you. Let's go to the business aspect a little bit, because it sounds all good, but as you know, and also in the around world, I mean, some startup companies who look like they are doing a great job in terms of revenue and transaction, everything looks okay, but actually they are not profitable. They're just burning a lot of money, but at the end of the day, they are not making any profits, and then they suffer later when they go for IPO or so. Can you tell us a little bit? If it's confidential, it's okay. You don't have to tell us everything. That will be your business confidentiality. But if you can share a little bit about your revenue model.
Sure. We, like I said in the beginning, we actually take a percentage cut from our doctors, and we take a percentage cut from our pharmacies network. And now we have appointments, we take a percentage cut from our hospitals. So we take a lot of percentage cuts from our supply. Because we are online, our doctors, pharmacies, and hospitals, we can do a lot more bulk orders. So actually, even though we're cheaper on a per patient basis, we actually do more in terms of just bulk, right? So we make a lot of our profit from that.
Okay. How about the competitors? There must be some competition in the market, and also there must be some differentiating point from Halodoc. What makes Halodoc so different from others?
Halodoc is the only one-stop solution healthcare that we have in Indonesia. What I mean by that is we are the super app for health. We are the only one that has teleconsultation, pharmacy delivery, appointment, lab, all in one application. We have other competitors, but they only focus on one of those products. So we are the most convenient, I would say, and I would say that we have the best doctors on our platform. One, because we are the most well-known e-health brand in Indonesia. So a lot of other doctors that want to work with us is also in quality, much better quality than the doctors that want to partner with our other competitors.
So, for example, if I just comes to my mind just now that let's say that I have some skin problem, and
Sure.
then I cannot go to doctor now because of the COVID-19, and then I open your app. Then when I choose the doctor, I want to, of course, make sure that I want to be consulted with by the best doctor. So can I do that?
Yes, we have skin specialists. Dermatologist is actually our number one specialist in terms of or how many people want to look for. So you can talk to a skin specialist on our app for I think right now around 30,000, which is about $2, and it will consult you for about 35 minutes. And then you can send a picture. If you're uncomfortable with a video call, you can send a picture of whatever skin problems that you're having. And if the doctor thinks that's not clear, then he will ask you to put on your video so you can look at the problem more in detail. And then after that, he'll prescribe you medicine. If the doctor thinks that he cannot prescribe you over our consultation, he will refer you to the nearest hospital wherever you live.
Okay, so let's say that there's let's say 5 dermatologists in the app, and then I want to choose the best one amongst the 5. How can I choose? Do you have any rating system or?
We have a rating system. Like I said, we do have a rating system in terms of what past users think of the doctor. So you can see from our rating system. But when we do our research and survey with our patients, I think a lot of different people look at what is the best doctor through a different lens. One is through rating, but two, a lot of people also want to look at doctors through experience, right? And sometimes actually we see that the one with the highest rating might not have the highest experience, right? So a lot of people, you can see the experience in years, which is important, I think, for a lot of people that, oh, the doctor has been working for a long time, has been working longer than 10 years, so I can trust him. So that is also something that we provide, where they went to school, the years of experience that they've had, what hospitals they're currently working in right now. So those are information are all available for our users to look at and choose for themselves.
So this rating system kind of makes sure the good quality of the service from the doctors or from pharmacists, right? Yes. Okay. So next question is, no matter how successful a startup company can be, if the business model or what they're doing is so easy to copy, then you will have a lot of competitors. So what type of entry barrier did Halodoc face yourself in the beginning? And then do you think it's going to be tough for others to compete against Halodoc model? So
I think for us, our entry barriers was one, like I talked about, the market itself, readiness, two, a relationship with our partners, right? Which is relationship with hospitals, relationship with pharmacies, relationship with doctors. So those are all entry barriers, as you need to have a good relationship with each one of them to make sure that they want to come onto the platform. So those were our entry barriers. So I think, will it be tough to copy the Halodoc model? Yes, because unless you have a good relationship with all of these different partners in healthcare industry and the support of the government, the support of the big health pharma, the big pharma as well, it'll be hard to copy our business model.
Okay, thank you. So based upon your 5 years experience so far, so how would you summarize the pros and cons of telemedicine?
I think the pros of telemedicine is it's accessible in Indonesia, especially it's accessible to everyone on the archipelago. We do have a lack of doctors in Indonesia, meaning that on a per capita level, we don't have enough doctors, especially in more remote areas of the country, like Papua, for example. They don't really have any specialists available on their island. So with telemedicine, we bring that network and have that availability for them, especially during this pandemic. It's very important that they can connect and talk to a doctor on a live basis, right? So that's one of the pros of telemedicine, connecting more doctors with patients that really need them. I think one of the cons of telemedicine is that you cannot obviously substitute going into a hospital or consulting with a doctor live when you need to, which is something we're not trying to replace, by the way. And that's why we have our appointment service. We're not trying to get rid of in-person consultation. Because we do see that sometimes it's not enough to look at things over the screen. It's not enough to just send a picture. You do want to, for example, take a scan, do an x-ray, have the doctor physically examine you. And those things are very important. So I think cons of telemedicine would be, it will never be completely make live consultation absolute, definitely, because you still need that interaction with a doctor for some sicknesses.
Okay, thank you. But in some countries, maybe in Jakarta and also Palembang, maybe Bandung, or all different situations, especially Jakarta, you must have many medical facilities. So can I just assume that maybe the users mostly are not heavily concentrated only in Jakarta, mostly other regions, areas in Indonesia? Because if the hospital is nearby, then I can just go and drop by there, right?
Actually, our most right now impatience is in Jabodetabek, which is the Jakarta area.
Oh, really? Oh, okay. Because of the traffic jam you mentioned also.
I think one is traffic jam. Two is, like I said in the beginning, if you want to go to a doctor here, there's also a lot of waiting line. The waiting line is like 2 hours to 4 hours long. While if you talk through Halodoc, you connect to a doctor within 1 minute, right? So I think a lot of people feel that it's much more convenient, so they like to use the service.
Wow, that sounds great. And then let's go to the next question. So how does collecting individual transactional data help Halodoc affiliated physicians or pharmacists and labs serve patients better?
We don't actually collect health data. I just want to clarify. We do collect transactional data, meaning if I see you've been contacting a skin specialist more than 2 times in our platform, we might offer you, for example, more skin products in our pharmacy delivery network, right? So I think in that sense, we can personalize and customize the journey of the customer much better on the app through your transactional data. But once again, I want to emphasize that we do not collect health data and use it in that way.
Okay, but at least I can see that if I have a medical history, can I keep it myself in my own app? Is it possible?
You can see all your history and past conversation in your own app, yes, and you can see the medicine recommendation that the doctor has given you, but you cannot access the chat again and read through it.
Yeah. Okay. Yeah. Indonesia, I remember that when I used to be in Indonesia in 2018, that some regions, some locations, actually the internet was very weak. And so in that case, if they don't have a high-speed access for the internet, then how can they use Halodoc? Do you think it's no problem technically?
Actually, it's very difficult to use Halodoc if you don't have high-speed internet access. One, obviously connecting to doctor is difficult. Two, we also have a problem with pharmacies network, right? If there's no internet. So that's something that actually we haven't had a problem with. A lot of parts of Indonesia now have good internet, but two, in areas where we see there's lacking in internet, what happens is we actually put tablets in the closest pharmacy or the closest medical center. And if you don't have a smartphone on you, you can walk to the pharmacy that has a tablet with Halodoc on it, or to the medical center in that specific area to consult online in that building. So if you don't have internet access at home in smaller areas, what we do is we work together with medical centers and pharmacies to ensure that people can still get access to Halodoc.
Okay, so I think I know that you have raised like a 100 million US dollars investment in capital. So how will we expand in the future?
Halodoc is focusing a lot on perfecting our services right now, and also going into other health verticals that we think would make sense. One of the ones that I mentioned earlier was 2 new services we're launching as appointments. So we would focus in the future on appointments with our hospital networks and increasing our hospital networks. 2 is actually our new mental health. We see an increase in interest in mental health, and that's something we want to work on. Right now, the mental health service is very similar to the other GP and specialist service, but I think in the future we want to make it more specialized to the type of user that will be going through mental health, right?
But with this, do you have any serious issues with also the lack of midwives in Indonesia? Or you have enough midwives?
We don't have enough midwives in Indonesia, right? And we do work with midwives to make sure that the right ones are connected in our network. Yeah.
So what is your next move with this $100 million in capital? And you want to increase the service more, or you have any plan to expand abroad?
We don't have plans to expand abroad currently. We definitely think Indonesia is a big enough market. And this is actually our passion, right? To focus on our home country and to make sure that we perfect and help Indonesia as much as possible before we will think about going overseas. It's not that we won't ever expand overseas. It's just right now the market is huge and we're still very small in this archipelago. I would say we are only very prominent in the larger cities, but as you know, we're not huge yet in the smaller parts of Indonesia, and that's something we want to focus on because actually the smaller parts of the archipelago are the ones that really need to be connected with a healthcare professional. So that's something that obviously we want to work on more in the future.
Okay, so now actually you're providing the service between the patients and the medical doctors, physicians, and also the service between the pharmacist and the patients. And then you said that you also have a service to help people with the midwives. And in the future, do you have any other services that you are considering?
Right now, no, actually. We've really been focused on helping out with the pandemic. So to be honest, we've been trying to perfect the services that we have to make sure that it matches with the pandemic needs. So no, nothing that I can share.
Okay, got it, no problem. If you save one life, you save the entire world in those terms. Halodoc has been successful. So do you have any closing thoughts on helping our world even more? Or any inspiration? Or
I think for me, I guess, I wish like a lot more people will be thinking about problems in their own countries and helping out in that way, focusing on even the smallest kind of issues and daily issues that people are thinking like, oh, this is the norm, which is the same with Halodoc, right? The healthcare industry in Indonesia has been like this for the longest time. And then one day we decided like, actually, this is not really acceptable. Like healthcare should be different. It shouldn't be so difficult to talk to a doctor. It shouldn't be so painstakingly taking your time off to go to a hospital when you're sick, right? And that was something that John and the founding team of Halodoc has decided to focus on and worked on. So I think in terms of closing thoughts, I think there's still a lot of things that can be worked on in a lot of countries, right? And if people were focusing on those problems and trying to find solutions, that'd be good.
I think so. Yeah. So anyway, Felicia, thank you very much for your valuable time. That I know you're very busy. Is it true that you are very busy? Right?
Yes. Yeah.
Yeah. Okay. I'm just trying to make a stupid joke, but anyway. So thank you very much for your time, and then I hope that we can keep in touch. And I'm sure that the other member countries also, some entrepreneurs really think about this kind of business to serve their people. I hope that this Halodoc case can be a very good example of the best practice. And then if anybody wants to, let's say they do the similar things in their own country, I think it can be a good example that if they can learn from Halodoc. So again, thank you very much for your time, and hope that Halodoc can serve as many people as possible in Indonesia, and then setting a good example as a social enterprise. Thank you.
Yeah. Thank you so much for your time.
Okay.
Bye-bye.
Bye-bye. Bye-bye.